Mr. Toscano.
Thank you, Mr. Speaker. I rise for a point of personal privilege.
Gentleman may proceed.
Thank you, Mr. Speaker. Mr. Speaker, ladies and gentlemen of the House, last week we heard several floor speeches exploring whether, how, when, and under what circumstances we can expand health care coverage to up to 400,000 presently uninsured Virginians. I'm optimistic that we can find a way, a Virginia way, to enact the reforms and provide the assistance that so many of our citizens need. And I'm heartened by the deliberate and thoughtful approach we are taking to this complex debate as it unfolds. Last week we heard a lot of discussion that we should be mindful of the future and commitments that we make. I agree. But I hope that our concern for the future will not prevent us from confronting what is before us and developing the best possible solution. Mr. Speaker, today I'd like to focus on one piece of the challenge, our hospitals. Last Thursday, the gentleman from Suffolk discussed the impact of federal cuts on our hospitals. He was right when he said that the federal Medicaid cuts do not take effect until 2015. But there's much more to the story, and this chart shows it. I have copies, smaller versions, for anybody who wants it. This chart shows loudly and clearly that the biggest challenge to our hospitals is not being created by Medicaid cuts. These are the cuts you see in the green at the very bottom of the chart here, and that the delegate from Suffolk referred to last week. They're relatively small. The big challenge is coming from the red and the blue. These are the Medicare cuts that are coming to the hospitals. A total of $207 million in 2014, rising to $393 million in 2016, and over $500 million in 2018. Ladies and gentlemen, to the hospitals, it doesn't matter the cause of the cuts. What matters to the hospitals is the impact of the cuts and whether we, as the elected officials, will do anything to stop it. These cuts are placing our hospitals and the communities they serve at considerable financial risk. Accessing additional federal dollars is pure and simple an economic imperative for the hospitals and the communities they serve. Just ask your hospital. They can see the future, and unless we act, it isn't very pretty. A couple of examples to think about. According to the Virginia Hospital Association, the Augusta Health System, located in the Shenandoah Valley, has already seen its federal monies decline by $4.5 million in 2015, and 2015 will bring another $3.2 million in losses. There's a story in the News Virginian this morning in the clips. You ought to take a look at it. Riverside Health System, with its 9,000 employees serving the peninsula, will lose another $9 million in 2015 on top of $11 million it's already lost. The Daily Press has an article on this over the weekend. You ought to check it out. Valley Health, a system with facilities in Page, Warren, and Winchester, recently laid off 33 people, and big losses are projected for that system in 2015. And the Fredericksburg Freelance Star just reported on Saturday that Mary Washington and Stafford hospitals project a loss of over $12 million by 2015. And of course, we've got Lee Medical Center, which closed down recently, and a loss of 140 jobs. There are many stories like this from around the Commonwealth. And if we do not find a way to bring our tax dollars back to Virginia, hospitals will be forced into making very tough business decisions that will hurt their employees and our communities. We didn't cause this problem. But the question is, do we have a responsibility to do something about it? I submit that we do. When we're faced with crises that affect our local communities, we step up. We certainly step up when there are natural disasters over which we have no control and no responsibility. We certainly step up when communities are affected by economic challenges caused by Washington. Think about BRAC, for example. Many of you were here when the BRAC decision came down on Oceana. That would have decimated that community in our Commonwealth and set ripples through the economy of our Commonwealth. Remember, the decision was to shut down Oceana. But we said we weren't going to let that happen. We acted. We could have decided we had no responsibility for that decision, but we didn't. We could have decided not to act because the future was not predictable, but we didn't. And we stepped up with Virginia tax dollars, not even federal tax dollars that we're asking for today, to make sure those federal dollars would continue to flow to that part of the Commonwealth. Our investment in that is now over $70 million in general fund monies, and there's another $7.5 million each year in this budget to help support Oceana, even though we are not sure that the feds will not try to close it. I submit the situation with our hospitals today is not much different. We do not know the future, but we know what's happening now. And right now, when our hospitals are facing huge cuts, we are refusing $5 million a day in federal money that could be used to help our hospitals and help our communities. So I hope that we can find a way, a Virginia way, to bring these Medicaid dollars back to the Commonwealth so they can be used to bolster our hospitals and our local communities. Thank you, Mr. Speaker.
Thank you.